Good morning and welcome to City Talk. It's a weekly program and podcast produced by the City of Waco and presented by this station as a public service to educate and inform everybody about the operations and work of the City of Waco. During the next half hour, I hope to bring you some interesting conversation with our city staff and community partners whose goal is to make Waco an enviable and safe place to live and work. I'm Larry Holsey, Director of Municipal Information. I'll be a host of this program, and it is a true honor to have with us today. And we're a totally different environment, but we have our Mayor Kyle Deaver, and joined by our Director of our Waco-McLennan County Public Health District, Dr. Brenda Gray. We're in a different atmosphere. This is a radio program. It is a podcast, but we're also doing it for TV. But also we've taken the opportunity to use good examples of social distancing that we're talking about. And so we've moved from our regular radio format location into more of a TV style. And so Brenda and I are probably 8 feet apart. Yes. The Mayor and I maybe 5 feet apart. So
we're
aiming
talk
that
6.
way and I'll talk this way and we won't do it.
Right.
We've got great information that we feel like we're going to share with you today. And hope this is things that will help you understand your city government, first of all, is doing everything possible. The health district is doing things. We may not talk about specific things because we're recording this at 10:30 in the morning on March the 20th, Friday. So things change. They evolve very quickly. So some of the things that might be said could change a little bit, but I just think it's great to be able to talk about the things. And first of all, Mayor, I would like to thank you the incredible amount of time, your leadership and everything else. When you took on the role of mayor 4 years ago, you probably didn't have any idea, none of us, of course, did, that this would be happening.
No, you're right, Larry. I don't think anybody that's in leadership saw this coming, certainly several years ago, or anything like this. And it has been a ton of work for everyone involved. I've got great people to give me advice from the health district and other health leaders around the city. But we've just got such a fantastic staff here at the city that is getting all the great work done to keep our citizens as safe as they can be during this challenging time. And it is changing faster than anything I have ever seen across the world, across our country, and in our community. And so we're going to have to continue to try to keep up and try to stay ahead of what we need to be doing.
And there's a lot of unknowns. I think that's the thing that's brought this to a scary position, because it originally started off, and it's still probably pretty much like it is, we hope, much like the flu that we've been preaching to people about all along, the same common practices, cover your cough, wash your hands, all those things. But the people don't ever seem to respond about the flu, but now they are about this. So that's maybe a positive thing. People have learned how to, and maybe next year the flu itself might be less.
And I agree, but I think one thing we need to point out is that the severity of COVID-19 is more serious than the flu, and that's why we have paid as much attention to it and we put as much resources toward combating and mitigating it across our community.
Yeah, thanks for saying that. I'm not trying to lessen the importance, but
I understand that.
As the onset, we were talking about a flu-like and everything.
Yes.
Right, that's right.
Well, you've had to make a lot of declarations, supported by whatever the state and federal laws allow a mayor to do.
Right.
Kind of help me understand, because you're also an attorney, help our listeners understand a little bit the protocol, because the president makes decisions, the governor's made decisions, and then the local authority has, and you are the local authority during a disaster.
Well, I am for the city of Waco, and obviously also we coordinate with Judge Felton and the County Commissioner's Court, because it's important to try to do this at as large a scale as possible geographically. The best thing, honestly, would be for the president to take action across the country to try to put in something that would be fairly drastic, that could get this thing stopped, get ahead of the curve. So far, he has not chosen to do that. Fortunately, yesterday the governor did that, so we at least have the state of Texas all acting under one set of minimum protocols. And but as mayor, I have the authority in a disaster or in a public health emergency to issue a declaration of emergency, which again is something I never thought I would have to do. It's really a very rare thing. But we felt compelled to do that after talking with our public health district and the experts there about what needed to happen in order to give our citizens the best chance of getting ahead of this. The order that I issue only lasts for 7 days, and so we will take this up at a council meeting, an emergency council meeting on Tuesday of next week, to extend the order for a period of time which is yet to be determined.
Yeah. Well, and I'm sure, like you say, and I want our listeners to understand, this is not an easy decision to do this because it impacts so many lives, so many jobs, so many everything. And so it's not anything, why did you do that? We did it because it is a disaster situation, and that's why it's a disaster declaration.
Yeah, that's exactly right. And to say it was not easy would be a real understatement. This was painstakingly worked through to try to come up with affecting the things that can make the most difference and trying not to affect people's jobs when we didn't absolutely have to. Everybody is going to sacrifice and hurt during this time, and we know it, and we hate it, but we're afraid that if we don't take action, the sacrifice would be greater later on. And so it's a matter of taking it now or taking it later, and by taking it now, we feel like we've got the best chance to make a difference. And Dr. Gray, you have something to add to that?
Yeah, you talked about our national leadership not putting some of the measures in place that would allow us to move more quickly than we have moved. But the CDC has a mitigation framework that the health district as well as the EOC and our city leadership has been operating under, so we can contain and mitigate the spread of the virus, so we can flatten the curve. And so with that understanding, we made those decisions based on a tremendous amount of guidance and instructions from CDC, and we are very grateful to have that, to be, really even from my umbrella of public health, to have that as kind of the criteria for helping us make decisions.
Yeah, that's a great point. I'm sorry. Go ahead.
No. I just want to take this opportunity, though, as I'm looking across from you. You've only been with the city for what, about a year?
9 months. 9 months. Going on 10 months, not a full year.
You've had a vast resource of knowledge, being a doctor, PhD doctor yourself, in all the things. We are so blessed to have you a part of our team and leading it, because again, it takes strong leadership from the council manager form of government we have, the mayor in charge, and then the health district advising and giving us a proper deal, just like the mayor indicated. We appreciate that and your team, and I know you have a good team and you work with. So.
I have a phenomenal team, and I want to say I'm grateful to be a part of this team, and very grateful for the support of the mayor, assistant city manager Deaver Emerson, the city manager Wiley Stem. It has been really a great environment to come into, to find that much support, to be able to have the latitude to do the work that we need to do at the health district to ensure that our community is safe.
Well, I want to delve into a part of what we want to do today is answer some questions that we've received, frequently asked questions, FAQs, that we have on our website. A whole lot of these are on our website, but these are specific right now that maybe a lot of people are asking. And the first group that I've got for Dr. Gray kind of deals with the health district, and this is provided by you people. At the press conferences, you spoke about community spread. Describe what community spread is.
So initially with COVID-19, and one of the criteria for us actually doing the test was it travel related. So when we can find a known cause for that infectious disease with an individual, we call that travel related. But when it's community spread, it's person to person. And that's the challenge we're having now. Well, the nation is having currently. But I think because of the proactive measures that the mayor's taken, our city leadership, we can get ahead of that curve to flatten it, because we're actively engaged in containment and mitigation strategies. And part of that is ensuring that people have the information they need to protect themselves. And as you said earlier, there's so simple things our parents and our grandparents taught us, enhanced hand washing, respiratory etiquette, cleaning frequently touched surfaces. And if you're sick, stay at home. And I think one of the challenges we have, not just here in McLennan County, but across the nation, we have this very strong work ethic, and people go to work, unless, they have to be hospitalized. And we have to kind of change that notion in our new norm to say, if you're sick, stay at home. And that's one of the ways we're going to really impact the spread of this virus, when we can, I guess, give ourselves the latitude to say, I'm staying at home, and not feel guilty about that. And I think that's the challenge we're going to have to overcome with people. And then we have the other challenge of people in the lower rung of employment, where they may not have the opportunity to stay at home. So how do employers support that work? And I know the mayor and our city management team is looking at how do we support those individuals so they can have that level of comfortability to stay at home, so they don't continue to affect the general population.
Well, one of the things that I'm impressed with is not necessarily covered by the order as such, but you're talking about jobs and things like that. We have a lot of businesses having to make tough decisions that impacts their bottom line. that are going to have to either reduce their operations, lay off people or whatever, but then coming forward and supporting them. So I think we need to compliment our business community for somehow making those decisions that are not covered by the directive from there too. One of the things, another question that's been commonly asked is that testing. Talk to us about testing, because everybody says, I want to get tested. I want to get tested. There's criteria that we have to screen to protect, because I know there are shortages of tests right now. Talk to us about the testing process.
So very early, the CDC set out guidelines. So if you had a fever, cough, or shortness of breath, and you had those things determined by a provider, then they would provide a test if tests were available. But we've been challenged because we have not got ahead of that whole process of providing tests at the local level, although nationally and as well as locally, we are getting access to more testing. So the challenge with that is we want people to know, if you don't get a test and you have those symptoms, please stay at home. The test may only confirm that you have it, but it allows you, when you go in for a test, to potentially infect our healthcare providers, which would really harm our ability to respond to COVID as it unfolds. So we're saying if you have symptoms, first, check the website of your provider, do that general online assessment, then call your provider and allow that person to instruct you how to move forward in your healthcare plan.
Yeah. Well, exactly right. And kind of following up from that, the next one is a lot of people are well, but they're hearing all this. So much of the panic by the media and everything, the negative, everything is consuming them. What do people do when they ask the question, I'm well, but how can I be sure, and how can I be tested, or but what? I'm scared. What am I supposed to do?
So one of the things I think we've been working really hard with the public health district as well as the city leadership is to get the message out that, we want people not to be fearful, but we want you to take those precautions. And so if you're a healthy person and you're concerned about if you have the symptoms, do the online assessments, call your provider. We're putting out a lot of information so you can read the information and then self-assess, but call your doctor if you have those concerns. And then if doctor asks you to come in, then come in. But we don't want people going to the emergency room. We don't want to overburden the healthcare resources that we have with people because of fear. So that's why we're trying to get the message out. If you have these symptoms, fever, cough, shortness of breath, or underlying chronic conditions, or you have those immunosuppressant immune systems that are immune suppressed, still call your doctor, call your provider, and get instructions before you go to the healthcare provider or to the emergency room center. And so we want to make sure people understand that if you're well, take those precautions to stay healthy. And we are saying across the board is that everybody has a role to play. The people that are healthy to stay healthy and if you're sick, stay at home so you don't spread the disease to other people.
Yeah. Absolutely.
Larry, we're right in the middle of pollen season too.
Yeah.
So everybody, lots of people have a little scratchy throat or a little runny nose, and so you're going to have to try to separate those symptoms. And Dr. Gray, how would you recommend people determine, at what point do I feel like I need to call my doctor?
I think if you've gone through the assessment, do I have a fever? Do I have a cough? Do I have a shortness of breath? Or even flu-like symptoms? Go to your website of your provider. They sometimes have online assessments. Take that assessment. Then a provider will either contact you by phone or they'll actually have you come in. If you've gone through the evaluation online, your provider will tell you whether or not to come in for a test or further evaluation. So I think if we rely on the healthcare system and if we do those things first, check the website, call your provider, get those further instructions, and if you're not severe enough to go to the emergency room, they want you to stay home.
That's a good question, Mayor. Thank you for bringing that up, because, again, we have a lot of people ask that. Excuse me. And I covered my cough, by the way.
Right.
And I went this way. What about people who work in retail? Obviously, they're working with the public, and they have people coming through. And what should they do to feel comfortable and confident? I mean, we're trying to keep the 6-foot distance, social distancing, as we call it. So what is the best answer for the people who do have to work with the public?
So some of the very practical things you can do, and you just mentioned social distancing. So CDC is recommending at least 6 foot of distance. And so practically, if you're making a purchase of retail, if you can stand within 6 feet to do your transaction, do that. But if you can't, do your transaction, step back. So you limit the time with that face-to-face contact with the retail representative and yourself. And then make sure that you're washing your hand. If you don't have access to soap and water, use a hand sanitizer with at least 60% alcohol. And for the retail person to clean those surfaces that are frequently contact more regularly so that you can reduce the spread of the virus.
If you just joined us, we're visiting with our mayor, Kyle Deaver, and our director of Wicklow-McLennan County Public Health District, Dr. Brenda Gray, and having great information. Hopefully you're going to be able to play this as a podcast as well. I want to shift to a couple of things that we've gotten from our code enforcement, who is the regulatory authority, I guess you'd call that's monitoring those things, and a question that they've had. Because sometimes we're dealing through these decisions these directives or ordinances that have been put out by the mayor. Sometimes always when you think about your own personal life, how does that impact it? I know we've had churches call us and say, do we have to cancel church? Well, churches congregate people. I mean, sure. Faith-based people are not immune to disease, sad as it is. So, but the question is, if a facility is closed under the order, for example, a gym or a health studio, but wants to provide a special event like a birthday, is that allowed?
And no, unfortunately, it's not. If they are that kind of business, then they have to remain closed even for special events. It's the same problem, Larry. It's the people being in close contact, and so for now, those businesses have to remain closed.
And that also deals with sad things like funerals.
It does, and we've had a lot of conversation about funerals and weddings and how difficult it is for those that have, are experiencing a loss in a funeral, or those that have been planning for months to have a big wedding. And the only thing that we can recommend is with a funeral, go ahead and have the funeral, have the closest family members there, and then live stream the event to a larger group, and then maybe you can have a memorial service later in the year after things clear up with more people, and have a celebration of life then. Same thing for weddings. Our live streaming technology is so good now and so inexpensive that it really is. I mean, it's not the same, and I wouldn't try to say that it is, but it's the best we can do right now. I'll tell you, I had a brand new grandbaby this morning.
Oh, congratulations.
I knew you were going to, but I didn't know it had been born.
But I won't be able to visit her in the hospital because they're limiting visitors to one visitor per day, and the husband needs to be there. Mm-hmm. So we're going to be doing it virtually through FaceTime or Skype, just like everybody else. And that's just the way it's going to be for a little while. And so we just have to live with that and be excited about that.
Well, you told me this morning when I was talking to you on the phone that you were expecting.
Yeah.
And so it's the distance between that and 10:30 in the morning when we
right.
Well, congratulations.
Right. Thank you. We're very excited.
And that's the thing about a mayor who is a volunteer position, not a paid employee of the city. He has life just like the rest of us.
That's right.
Thank you for bringing that up, because that's a good thing.
Sure.
Okay. If my daycare is my daycare required to close?
No, and we are asking daycares to take special precautions, and they are doing that to try to limit the. They're trying to pick the children up at the curb rather than having the parents bring the child into the daycare and things like that, to try to keep those workers and those children as safe as possible. Daycares are really essential to allow the people that need to be doing their work, especially the healthcare workers. We've got to try to keep daycares open so they are not closed by the order.
Talking about beauty and hair salons, are they part of the order to close?
No, they're not, and that's a really close one, because that's a difficult one, because they are in very close contact with their customers and their clients. We just ask that they use the best practices that they can right now, and they may decide to close on their own. Of course, we don't have to close, as you mentioned. A lot of businesses have just decided this is not a good time for me to be open, and I think that's a tough choice that every business person has to make and really carefully consider.
I had one follow-up to that I checked with the legal department, and they said the best description is for beauty shops and things like that, no greater than 10 people in one room or confined area, as it may be. Right. A lot of beauty salons, and they're larger, so if you get the kids to stay home, just you, if you're going to get a hairdo or whatever you want to call it. That's old technology. Hairdo. Well, obviously I don't have a hairdo. But anyway, that's the type of thing that just minimize the amount of people going in that type of thing.
That's right.
Are the Richland Mall and Central Texas Marketplace going to remain open?
They are remaining open under the order. They're not closed at this time. I know that some of the businesses inside some of those facilities have chosen to close, but the order does not cover those kinds of places.
Do cleaning and lawn care businesses have to shut down as well?
No, they are not covered by the order, so they can continue to work. Those are probably some of the safer jobs because they're outside and working away from each other.
Okay, here's a real tricky one. Because you mentioned about your new grandbaby?
Right.
Granddaughter?
Granddaughter. Yeah.
Amazing.
Ellie.
Ellie. Well, there you go.
Thank you.
See there, you heard it first right here.
That's right.
Well, not by the time this airs, maybe.
Right.
Would a gathering at my private residence or apartment, if more than 10 people, be considered a community gathering?
Yes. Yeah, absolutely. It's the same problem. We've got to keep social distance and try to minimize this interpersonal contact that can spread this disease.
Absolutely. I'd like to add something here because when you're asking these nuances of the question, what people don't realize is that the more stringent the orders are around social distancing, the greater the impact is on community spread. So it seems very stringent. It may be invasive to some people, but when we think about the ability to limit this disease spreading, these measures are very necessary.
Right.
I'm not going to go through all of these, but on our website we have a list of frequently asked questions that I think anybody, and I'm just going to kind of read the questions. We're not going to give the answers, but I challenge our listeners to go out and find this on the website to get those answers. But how long does the order last? You already talked to that. Right now it's 7 days, but could be extended. Will the surrounding cities of the county be following the same recommendations and making similar declarations? Each one does.
Yeah, so the county just passed an order yesterday, which they passed one the day before, and then they enhanced it yesterday, making it stricter. And we are now pretty well aligned with the county and the other cities around us with what our requirements are. So yes, and I expect these to extend for a period of time. Yeah. We don't know what that period of time is yet, but it will certainly be another several
How about
weeks.
Enforcement? This is a question about enforcement. Will it be enforced and how?
So the enforcement mechanism is that it is a Class C misdemeanor to violate this order. It's punishable by up to $1,000 fine, and
per day.
Per each day that a business continues to open when they're not supposed to be, they're subject to additional fines. And the way that it's going to be enforced is we are not going to go out looking for these, but if we see them, we're going to act, and if we get complaints, we will check them out immediately.
I'm just going to go down the list because I don't expect you to answer all of these, and because you've already touched on some of them. Is my daycare required to close in this order? Will the grocery stores remain open? What about the Richland Mall? We already talked about that. Does my church have to cancel services? Can we still hold meetings, birthdays, book clubs, all that kind of stuff? We've talked about that here, but these are answers already. If my restaurant, bar, gym limits access to 10, can they stay open? These are questions that are very common, but I challenge you to go to our website, which is waco-texas.com, and on that page you're going to see a vast resource of all types of information. First of all, you can get the latest COVID-19 updates, not only from the CDC, but from the Waco-McLennan County Public Health District. Those things are right there. It's a full fact-finding area. Anything you want to know about the virus, it'll take you directly to the health district, who has even more resources, links and things. So I'm just going to say there's a plethora of information. So if you really want inside information, locally produced especially, we can provide that to you. So use our website. We're also using Facebook and Twitter and all those social media things to regularly put that out. And one interesting thing I want to talk about our website real quick is the fact that we've made it totally translatable into Spanish. So at the very top of our homepage, waco-texas.com, you'll see a button off to the right that says Translate. So anything on our page will instantly be translated to Spanish. So we want all of our community to be involved. And Mayor, you mentioned earlier about the press conferences. We had the sign language. So we're trying to make sure that all areas.
Yeah, that's really been a focus of the city is trying to be more accessible and inclusive, and having Spanish language translating and American Sign Language translating is part of that effort. I really appreciate the work that you all have done to make that happen, and the city secretary's office has done to make that happen.
Yeah.
One thing I wanted to mention is that the number of cases that we are experiencing at the health district will be updated each day on the website at 1 p.m. So if you want the latest information, that's where you can find that.
Thank you for bringing that up. I was going to mention it, but I don't see it on my notes, so
Sure.
I probably would have forgotten
Sure.
it. But one other thing I want to bring up is the fact that there's a lot of things on our website that help you know what you can do, especially with the kids and things. So we want to focus now for the last 2 or 4 minutes that we have on the program about things that the city is providing, what to do, because here we are, we're consumed with this. We're forced to stay home. We're leaving our jobs and things. What do? You can only watch daylight save. I'm going to say Days of Our Lives, but soap operas and things like that so much. But so there's a resource on our deal, and it goes takes you to our Waco Library. Our Waco Library has an amazing amount of things planned for you, and there's links to programs, and I'm just going to touch on a few of them. There's a free website that every day at 1 p.m. There's a graphic novelist that does a program for kids. There's live streams from professional authors. There's daily doodles at noon. There's podcasts for kids. All those resources are on our website from the library. And speaking of the library, they're stepping out and doing, since all the libraries are closed now, they're stepping out and they do curbside book pickup. So you can go on the website and find out how to check out books and have them ready. And all you have to do is give them a call and say, I'm outside. Can you bring them to me? And I think the wet library has also waived any fines that may be restricting people get access to the library. So we're trying to be very friendly, encouraging positive things to happen from there. And with about 2 or 3 minutes left, I want to make sure that the website certainly has all the health history information. I printed that out, and there's so much information. There's a map of the world where the cases are, all the CDC and all that type of thing. And so I'm kind of wrapping up here. Mayor, do you have some comments?
Couple of things. One thing is that we have required all the restaurants to close, but we're allowing them to do takeout and delivery and drive-through. And I would really encourage our citizens to take advantage of that. These restaurants need your business, and it's an easy way for you to pick up a meal to have at home. So please do that. Also, this is a great time for you to fill out the 2020 census. And everybody's got time on their hands right now, and this is so important to our community. For every person that is not counted in our community, we lose $1,500 per year, so $15,000 over the course of the next 10 years until there's another census. And it is very easy to do online. You can also mail in the census, but go to whyicountwaco.org to find out more about how you can fill out the census, or just Google 2020 census. It will pop up, and all you need to do is put in your address, and it takes less than 10 minutes to fill out.
I'm glad you brought that up, because really, in a way, the census helps determine the future of how monies from the government are distributed.
Absolutely.
And we're talking about all these new projects and these new things that are going to be brought into the community. A lot of that is based on the census numbers. How many does the Waco-McLennan County area have to be able to receive, as they do this $1 trillion or whatever they're talking about distributing to individuals.
Right. That's exactly
And the other piece is the number of representatives the state has to have our voice being heard in Washington, D.C.
Absolutely. Very, very critical.
Yeah.
And I've said on this program many times the most vulnerable people and the most critical people who are receiving the government supports and things like that are the ones who definitely need to fill out the census, because they're the recipients of many of it.
That's right. And, the Census Bureau is restricted by the Constitution from sharing private information with any other branch of the government. So I know that there is some distrust of the government, and I understand that, but this is so important. There is not a question about citizenship on the census this year, as was previously discussed. It is just critical that we get everybody to fill that out.
One last thing that comes to my mind, and it's personal, because I haven't been able to go to the grocery store in 2 weeks. And I've got one roll of toilet paper left, and I've held on to it now for a whole week so far. So people, try not to hoard things, and try to realize that there's others out there that are needing, and it's not just like me. There's others that are trying to do the right thing, and we need to share and be a part of the community to do that.
That's a great message, Larry.
I'd like to add something too, Larry. You talked about kind of our vulnerable populations, and I want to make sure that people are thinking about the most vulnerable in this time of COVID virus, and that as it's impacting our community.
I'd like to thank Dr. Brenda Gray, who's the director of our public health district, and our mayor, who is a volunteer position but has assumed an amazing strength of leadership. Positive it is for being our guests on this particular program. Thank you all so much for what it is, and thanks for being with us.
Thank you, Larry.
We hope you'll join us again next week for more information about the city of Waco on City Talk. This program is produced by the Municipal Information Department of the City of Waco and is provided as a public service by this station.